Hi, everyone. Welcome to today's Research America meeting. This session is the first in a series of special discussions during which we'll hear from the recipients of Research America's 2022 Outstanding Achievement in Public Health Award honorees. These awards are generously supported by Johnson & Johnson, and Research America is so grateful to Johnson & Johnson for their support and really excited to introduce you to the honorees over the upcoming weeks. We are holding these discussions also as a way to lead up to Public Health Thank You Day, which is, I think we've done this day for probably 15 years now or so. It's on the Monday before Thanksgiving, November 22nd, and it's an opportunity to thank the workforce, the public health workforce, and the diversity of individuals who work day in and day out, particularly I would say over the last couple of years, but every single day to protect our health and security in this nation and across the global community. To start the special series, we are thrilled to be joined today by two honorees, both of whom are being given an Outstanding Achievement in Public Health Award, the eponymous award, Bill Novelli and Matt Myers, the founder and leader, respectively, today of the Campaign for Tobacco-Free Kids. I'm also so pleased to have with us to moderate the discussion one of our board members, Dr. Georges Benjamin, who is the executive director of the American Public Health Association. And as always, please type your questions into the Q&A box or chat, and we'll gladly do our best to pose them when we get to that section of today's session. And also, I'd like to thank you for your partnership. If your organization is not a member of Research America, shoot me an email, anyone on our team, or go to our website, and let's have a conversation about it. We'd love to have you join. With that, Dr. Benjamin, let me turn it to you.
Ellie, let me thank you very much for having me today. And let me just tell you what the honor it is. I get to interview and have an amazing discussion with two of my heroes here. Bill Novelli and Matt Myers have really, I think, in many ways, defined the way public health can change society. And so, Bill and Matt, welcome to our conversation today.
Thanks, Georges. And that I want to say on behalf of myself, how much we appreciate Research America's support and the award. It is truly an honor.
Yeah, I agree. And thanks also to APHA and to you, Georges.
Thank you, Bill. Matt. Well, look, I gave the tease because in essence, what you have done is you have really led an effort to change societal's thinking around tobacco. So from each of you, what made you decide to take on this cause?
Let me jump in and start. Tobacco, like so many other public health issues, is one of those issues that simmers below until you look closely. When I first became engaged, I was shocked to know that 500,000 Americans were dying every year from a product that somebody was marketing to our nation's kids, and that government wasn't doing its job. This was an opportunity from my perspective to bring the skills of an advocate to a public health problem that was crying out for help but was being neglected, with the potential to save not one life, not two lives, but literally millions of lives at a time. So it was one of those challenges that, as somebody whose whole life had been as an advocate, where you could have an impact on more people more rapidly, and you could deal with the fact that there was an industry preying on our nation's children and our poorest, most vulnerable populations.
Yeah, that's so true. Georges, I began because in my Porto Novelli days, one of our biggest clients was the National Cancer Institute, and we were working on tobacco with them. And in those days, you may remember this, physicians and nurses smoked at higher levels than the general population. And so that's what we worked on. And so I got very interested in this. I connected up with Matt we had a hero in a woman named Nancy Kaufman. And Nancy Kaufman was a buddy of Matt's and Mike Perchuk's and others. And what they concluded was we had to fight the industry, and we weren't. We needed a tobacco institute for the good guys. And that's how we got started.
You know,
Wow.
Bill, let me just, if I can just add to that, because it is so true, is when the Campaign for Tobacco-Free Kids was first created, which is now 25 years ago, that's hard to believe. A lot of organizations were working on tobacco issues and made an enormous progress. But what was missing was an organization that could look at this issue with single-minded focus and bring the best of what we know how to do public health, public policy advocacy to this. You know, we used to joke, but it was really true. The good guys deserved advocacy as well done and as focused as the bad guys. And we thought that if we could go toe to toe with them, if we could focus attention on the magnitude of the problem, on the solutions, and create a sense of urgency, we could make a difference.
You know, this is a fascinating story. You know, and every story has a backstory. Can you two give us the backstory? I understand why you wanted to do it, but what's the backstory?
Well, I think the backstory is one of your colleagues, Steve Schroeder. So, you know, back when we started, Matt said it was 25 years ago, we were in crisis. Youth smoking was at all-time highs. The tobacco industry was really riding high. I mean, they were giving huge amounts of money to policymakers. They had all these law firms and ad and PR agencies sewed up. They were selling an addictive product. And really, for us to be able to start this thing, it took Steve. He was able to convince the Robert Wood Johnson Foundation board to invest heavily in this. And that's really how we got started. And without that, there wouldn't have been a campaign.
You know, it's so true. In so many ways, tobacco is a predecessor or a leader for other issues. When I first began working on tobacco, which is shockingly 40 years ago, there wasn't even a national coalition working on the issue. In 1981, the American Cancer Society, the American Heart Association, the American Lung Association decided that the issue was important enough that for the very first time in their history, and this is shocking, they were going to join together in a coalition to advocate on a public policy issue. And I mean, think how far we've come, that it was 1981 and those organizations had never worked together on a public policy issue until that time. And so it is the evolution of an understanding that while tobacco, like other issues, is a public health issue, its solution is one that is resolved in the public arena, the role of government, the role of grassroots, understanding how media works with regard to these issues, what motivates politicians to do the right thing or to ignore pressing problems. And so we grew from 1981 with a coalition on smoking or health to a recognition by the mid-90s that we needed something even more. We needed something that could focus like a laser beam. And, you know, Bill is right. When Steve Schroeder and the Robert Wood Johnson Foundation provided the initial funding for the Campaign for Tobacco-Free Kids, it was the first public advocacy campaign the Robert Wood Johnson Foundation had ever funded. It's hard to look back that far to realize how much we've learned and how important it is for us to have a presence in that public health debate. It's why it's so important for public health issues across the board to be more visible, to be better understood, and to have the benefit of people who are able to bring a sense of urgency to act for action.
So, you know, how have attitudes changed? And we always talk about what gets measured gets done. You know, how did you measure success? And, you know, what were some of the milestones that you thought were important along the way?
You know, well, Bill was right. When the campaign was created, over 36% of high school kids smoke. Today, that number's down to about 6%. 25% of adults smoke. Today, that's down to 14%. Only 3 states provided meaningful protection for people working against secondhand smoke. Today, 27 states and over 60% of the American public is protected from secondhand smoke with regard to that. When we were created, only 3 states had spent more than $1 million a year for public education campaigns, and the federal government had never actually funded a mass media campaign on tobacco. All of those things have changed. And with those changes, we have changed as a society. Smoking is no longer the norm. It's an abnormal behavior. People expect to be protected from secondhand smoke. Even a smoker will tell you that they don't want their kids to smoke today. It's that sort of attitudinal change that is so fundamental to long-term change that has made the greatest difference. And the exciting part is it results in real changes. We have seen dramatic decreases in the risk of lung cancer in the American population. We've seen dramatic decreases in the risk of heart disease from tobacco as a result of these things. And for me, even more exciting, over the last decade, we have seen a shrinking of the gap in lung cancer risk between African Americans and white Americans that is a direct result between the changes in smoking rates in those populations. This is one of those public policy changes that actually makes a real difference.
Well, that's neat. That's neat. Well, to both of you, the campaign intersected with the Tobacco Master Settlement Agreement, and right now I sit on the Truth Initiative board, and that foundation would not have been there without that agreement. But the campaign was certainly part of that. So, what was the intersection there between that actually getting the courts to do the right thing?
There's a lesson there, and there's a lesson for us today. Back then, the tobacco industry wanted what they called certainty. They wanted an environment in which they could market their products. And so it was an opportunity for the attorneys general to sit down and negotiate. And we sat down with them, and Matt was our chief negotiator. And every night we'd have a meeting with our board members and go over what we learned and what was happening and what we were going to do. And the lesson really, I think, George, is all these issues that we deal with, tobacco being prominent, but also climate action, immigration, all kinds of other things, they require getting everybody at the table. At COP26 last week, NGOs and the youth advocates, they said, we don't want these fossil fuel companies here. They're the bad guys. They're the problem. Well, you can't solve climate change without getting everybody together. That goes for everything from obesity to you name it. And we fought that fight. We got beat up for it, but it made a huge difference. And your Truth Initiative made a big difference too.
George, it's also a great example of using all the tools that are available. Public health advocates working with attorney generals were able to help ensure that this information that tobacco industry kept secret from the public for decades became public. Coordinating with members of Congress like Henry Waxman and now Senator Durbin, they were able to hold hearings that exposed the wrongdoing to the American public. Those lawsuits were the reason that we had that famous hearing in 1994, chaired by Congressman Waxman, in which now Senator Wyden asked every CEO of a tobacco company, do you believe that nicotine in tobacco products is addictive? And the shocking answer from the tobacco companies that no, they didn't, helped transform public attitudes in ways that public education campaigns could have spent hundreds of millions of dollars and wouldn't have had the same effect. So it is a perfect example of working with state attorney generals to get the courts to make this industry transparent, to get the information out, to get the information framed, and transform the whole public debate about it. You know, in many ways, the money that came from that settlement is probably the least important part, but it's important with regard to that, because it did. Perhaps the most effective thing it did is what helped fund the Truth Campaign with its cutting edge ads, with its campaigns focused on turning youth rebellious nature into the anti-smoking campaign rather than the pro-smoking campaign, as the Marlboro Man and Joe Camel had done for decades before. You know, so there's some real lessons about how we do public policy there in working with attorney generals. And we've seen the attorney generals do the same thing for us now, more recently with regard to e-cigarettes. The number of state attorney generals who've sued the e-cigarette industry over their marketing of flavored products to kids has helped transform that discussion as well. And the Truth Campaign is a key part of educating kids on those issues as well. So it's a classic example of using the tools there. And I like to think that Bill and I served a useful role with the state attorney generals because they're not experts in public health. They needed somebody, A, to keep them informed on what was most important, and B, to hold them accountable for making public health the priority, not just money.
Well, what are some of the new frontiers? I mean, you know, obviously, we've not completely solved this problem. What's next on the agenda?
Well, first of all, I think we all have to realize that the tobacco industry will never give up. So you've got vaping today to contend with, and that's a serious issue. And you know, the Truth Campaign is going after it in a novel way. They've looked at what kids care about today, and as you know, Georges, it's mental health. So Truth is tying mental health to vaping. The tobacco industry's got this heat don't burn technology, which they're coming out with. Philip Morris International says they're going to unsmoke the world and become a harm reduction company. Meanwhile, it's projected that there'll be 1 billion smokers by 2025. And so what's next is we've got to fight this fight internationally. And the campaign is doing that. It's taking this on internationally, not by itself, but through indigenous organizations that understand advocacy in all these different countries.
Well said, Bill. And I was going to say, one of the joys of working at the campaign is that we now do in fact work in low and middle income countries all across the globe, because the tobacco industry realized that as sales were going down in wealthier nations, that was their future. And our job has been to bring the kind of advocacy to low and middle income countries that has helped bring about change in the United States. But you know, there's an important next set of activities in the United States as well. Bill correctly points out that e-cigarettes in the industry continues to push to undo the change we've made. But there is another target that we have got to focus on like a laser beam, and that is the tobacco-related and tobacco-caused disparities in our nation. We have done much better in reducing tobacco use among wealthy, highly educated individuals. What we need to do is focus like a laser beam on two categories. One is people who live in states and communities that have been unwilling to tackle the tobacco problem. And second, the data shows that the risk of using tobacco is directly related to income level, educational level, and certain populations that the industry has targeted. That includes the African American community, the Hispanic community, the LGBTQ community, our Native American populations, and those people who suffer from various symptoms of mental illness. So as the next step for the community, we have to figure out how we make sure that every American gets the benefit of the public policies that we know work. And we need to ask ourselves core questions about what adjustments we need to make and our priorities to ensure that we're reducing those disparities every single day.
Thanks, Matt. You know, I think we've got some questions from our audience, so let's go to them and see what we have. And I think Anna's going to join us to
Yes.
feed us those questions.
Yes, absolutely. And just as a reminder to folks, please feel free to put your questions into the chat or the Q&A, and we will do our best to pose them. So one topic that came up in this conversation is the media. And how has the campaign, or did the campaign, evolve its media approach over the years as media changed and the public's relationship with media changed? Can you talk about that a bit?
Well, when we started, we said to the Robert Wood Johnson Foundation, which was our main funder, we said, if you give us this money, we are going to be aggressive. So don't give us the money if you don't want us to attack the industry. And they were courageous. They gave us the money. And the first thing we did was to run ads attacking the industry. And that really set things off. It put not just the campaign on the map, but the issue on the map. And I think to a certain degree, it put the industry on defense. And it also, to a degree, I won't say shamed, but let's say got the attention of policymakers. And over the years, even though the campaign is more a policy shop and Truth was dealing with youth smokers, the campaign kept up its media barrage, and even today is continuing to do so. And Anna, that the media of course have changed. And so what we've got now is way more fragmentation. We've got a situation where people are more informed than ever before, but they're not better informed. And in fact, you could argue that disinformation and misinformation are the biggest problem we have in the media today. And that's true, I think, in tobacco, but we set the stage. And I think our media back then and even now has made a big difference.
And Anna, as times have changed, we've both evolved and I hope become more sophisticated. We recognize when we talk, you asked the question about the media, but we think about communications as a comprehensive approach. And that is earned media relationships, making sure that our story gets told to good reporters who are out there, making sure that misstatements in the media are corrected in real time, making sure that we make available experts to appear in the media, and make sure that they understand how to deal with the media when we're doing it. Use paid advertising where appropriate, complemented by other activities with regard to those things as well. And in today's day and age, what you have to do is think about the media as the multifaceted approach. It's not just the traditional news media, it's social media where you have to be present and make sure your message gets across and where others get corrected. It is in all the cable news and all the other ways that people get information today that we need to be out there. And I'd like to think the other thing that we do, because we do it consciously, which is to work with other people who care about this issue so that they are comfortable working with the media. Because what we need is a diverse set of spokesmen from every community who understands how this problem affects them and how we can work with them to ensure that they have access to the media, that they understand how to use the media in the most effective way, and to understand that in today's day and age, we're trying to reach audiences who no longer just watch one of three networks. Right. And therefore, you have to ask yourself the question of who is it you're trying to reach? What's the right pathway to do that? Who are the right spokespeople to do that? What's the information that they will respond to as opposed to the general public will respond to? And how do you keep a drum beat up? I've often joked to people, a media campaign isn't an ad. It's a comprehensive campaign where you ask yourself the question, who are we trying to reach? What are we trying to communicate? What's the best way to do it? And how do we repeat our message as often as the bad guys repeat their message?
Right. That is so interesting. Thank you. Thank you for that to you both. Another question that has come in your opinions, should the FDA reduce nicotine to non-addicted levels after it bans menthol, or are there other game changers that the FDA should consider?
It's a great question. Go ahead, Bill, do you want to jump?
No, go ahead, take it.
There is nothing that would reduce tobacco use more than reducing nicotine levels to nicotine in cigarettes to non-addicting levels. But it needs to be part of a comprehensive plan, because we need to understand that there are people out there who do smoke, that we need to provide a transformative period of time to work all of those things through. We need to be sure that we're providing cessation assistance effectively on a mass population level to the populations who currently most smoke. We need to do a real strong public education campaign. But if you think about it, the tobacco industry often says smoking is an individual choice. Eliminating nicotine as an addictive substance will truly make it a free choice. And then let's see how many people do it. I think the answer to that will be, we will reduce the death and disease from tobacco use more rapidly, more dramatically, and in more populations than anything else. But we need to do it as part of a broad strategic plan. It's one of the reasons why we are both supporting the conversation about that and working to drill down to ensure that in the communities that currently smoke the most, that we're talking about how we provide assistance in those communities, how we eliminate the things that encourage them, retail outlets in every corner in a low-income neighborhood, images projected by the tobacco industry that still make these products appealing to certain populations with regard to those things. So it is one of the most dramatic ideas that has ever been proposed. And 20 years ago, it would have seemed crazy. But with smoking levels where they are today, it is something that we can genuinely consider as a legitimate policy that would, in fact, for once, change the future.
Wow.
You know, Anna, there's an old saying in this war, which is whoever controls nicotine will win the war.
That's a good one. Yes, thank you for sharing that, because that's so true. So true. So Bill, a question that has come in for you, actually, in your book, Good Business, you talk about instances in various campaigns where a strategy you thought would work didn't actually pan out. Do you have an example from this campaign that you can share, and how did you shift gears when that happened?
Well, that's a terrific question. You know, the first Surgeon General's report came out in 1964 about tobacco. So think about that. From 1964 till, I'll say, the early 2000s, we had to figure out what strategies would work and what strategies wouldn't work. And we ended up coming up with 5 that worked. And, you know, today, if you're working on a totally different subject, let's say it's climate action, you've got to find the right strategies. And so the 5 strategies, 3 of the 5 were direct policy advocacy. So one was increasing taxes on tobacco. And that was hard to figure out. A lot of the states didn't like that. And so increasing the tax rate on tobacco had a direct effect on both youth and adult smoking. The next strategy was persuade kids not to experiment and become addicted. And that's where truth played a major role. I wouldn't call that policy advocacy, but it's effective communication and marketing. Helping adults who want to quit. Now, probably 80% of adults want to quit smoking, and it takes them 5 or 6 tries. So they need hotlines and all kinds of things. And then eliminating smoking in public places. There are people on this event here today who will remember smoking in airplanes, smoking in classrooms, smoking in offices. Getting rid of that had a huge strategic effect. And then the last thing Matt talked about earlier with regard to the Marlboro Man, and that was to curb tobacco marketing. So those 5 strategies worked. Others, you know, didn't work so well. And if you're working on a different issue today, you got to find that recipe.
Right. That's so true.
And I'd give you 2 examples. You know, the first are tobacco taxes. When we first started advocating for tobacco taxes, precisely because price does make a difference, and it makes the greatest difference among youth and low-income individuals, we were routinely unsuccessful. Routinely unsuccessful because public officials thought about tobacco taxes purely in the form of revenue raising and correctly thought of it as a traditional regressive tax. And we didn't begin to have success until we did a couple of things. One was take advantage of the growing body of research that showed that raising tobacco taxes was the most effective tool in reducing youth tobacco use. But equally important, that tobacco taxes disproportionately benefited low-income individuals because they quit smoking at far higher rates.
Oh,
and
wow.
particularly if you use the revenue from a tobacco tax to provide cessation services in those communities, you could have a true win-win. And then, we actually came up with a win-win-win strategy that we called as we began to do this. It was a win for the public, it was a win for the population, and it was a win for public health with regard to those issues. And it was a lesson that we had to learn over time after stumbling multiple times. A second good one is the one that Bill talked about, which is protection against secondhand smoke. In the early days, we thought it was too brazen to say you have to ban smoking in all workplaces, including bars and restaurants.
Mm-hmm.
And if you'll remember the days, the interim step was designated smoking areas. Well, designated smoking areas don't work.
Right.
So we had to take that next step. And that was a challenge because you had to convince people, particularly in the hospitality industry, that it wasn't going to destroy their business. When Mike Bloomberg first proposed banning smoking in all restaurants and bars in New York City, both the Restaurant Association and the Chamber of Commerce took out ads saying he was destroying all commerce in New York City and no tourists would come to the city ever again. Fortunately, Mike Bloomberg didn't listen to them and said this was the right thing to do, it would save lives. And lo and behold, within 6 months, restaurants were saying this is the best thing that's ever happened. Business is greater than ever before, and tourists were flocking to New York City. It's one of those classic examples where you have to stand up to the very difficult challenges. And the battle against secondhand smoke is one that never goes away. Every place that does it looks back and says, how did I ever live in an environment where to eat a meal, you had to breathe somebody else's smoke?
Mm-hmm.
And to this day, we're getting ready for a battle in Parliament in India to get rid of designated smoking areas in restaurants in India, where the restaurant industry still says it's going to kill our business, despite the fact that it's been good for business in every restaurant in every country where it's ever been tried.
Wow. And that's just fascinating. I have a million questions, but to keep to audience questions. So that's a perfect segue into one that just has come in. So the website for the campaign mentions different global initiatives that you're working on. Are there unique challenges on working, on a global scale versus domestic? And can you talk about that global work a bit?
It's a great question. Let me answer it in two quick ways. First of all, what we have learned is that the same public policies actually work across political and different cultural situations. But the difference is that every campaign has to adjust and be locally led by people who understand their community and understand the messages of their community and the values of their community. And so both one of the challenges and frankly, one of the joys of doing the global work is to work with grassroots community organizations in countries across the globe and to ask ourselves how we can help them do effective advocacy in different political systems, in different cultures, different religious communities with regard to that. And so our task there is to truly be humble, to say we understand what policies work, and we need to listen to you, and you need to tell us how we can help enhance your ability to be effective in your community. And the exciting thing about it is that we've seen it work. We have seen strong tobacco control measures adopted in countries where it was locally led organizations doing it. In countries as disparate as is Russia to India to Brazil to Uganda, Nigeria. The lesson learned is tobacco control advocacy can serve, I hope, as a model for other public health issues. How if you allow locally led organizations to lead and provide them the technical assistance they need, you can bring about policy change that is fundamental across the globe. And there isn't, I truly believe, there isn't a political culture where it won't work if we listen carefully.
Fascinating. Thank you for that. So another question that has come in, psychology plays an active role in helping smokers quit, and people with diagnosed mental disorders are twice as likely to smoke than people with no mental health concerns. How is the campaign using psychological science to inform the strategies that the campaign's working on?
What I would say is this, I think the campaign has been really good at reaching out to get the kind of research that's needed. Whether it's research that the CDC is doing, the NCI is doing, epidemiologists, the Schroeder Center at the Truth Initiative, you can't make stuff up. You need research to inform your communication, to inform your advocacy. So, psychological research is just as important as epidemiological research. And I think the one thing that we probably have taken pride in over the years is really is tapping different experts and making sure that we had what we needed.
That's so much the key to all public health advocacy. It needs to be science-led, science-driven, and understanding that you can't be driven by ideology. You have to ask yourself the question, if you're trying to reduce death and disease from a particular cause, in our case, tobacco, what does the science say about what's the best way to do it? What's the best way to prevent people from starting? What's the best way to change attitudes? And for the different populations who continue to smoke, what's the best way to impact their behavior in a positive way to do that? And it's one of those things where you have to keep track of the new science to do it on these issues and carefully measure how different activities work. And part of our job is to get government to do its job. As we learn what works, our job is to ensure that government funds those programs, supports those programs so that they can be delivered on a population-wide basis.
Mm-hmm. Mm-hmm. That's so interesting. So I think we have time for just one more question before we wrap. Is there a good reference for the point about working with local communities? Any references you would recommend there? Not to put you on the spot.
No. I mean, there's some really terrific tools out there. The CDC best practices on health equity provides a good lodestar for that. And actually within the campaign, you give me an opportunity for a short plug. Within the campaign, we've created what we call a health advocacy incubator that is designed to work with local organizations and to develop training tools for them to build their advocacy capacity, to build their organizational capacity, to understand sophisticated communications work. And the goal there is to have a set of skills that are adaptive to different communities at different stages of development. And frankly, on the public health issues that go beyond tobacco, our Health Advocacy Institute has helped reduce road safety deaths in about a dozen countries around the globe. It's working on food nutrition policy with organizations around the globe. And our task in all of those things is not to do the work, but to help the local organizations develop the skills to be able to do the work in their own communities.
Anna, one really quick point is that if you're going to do policy advocacy, whether it's at the national level, the state level, or wherever, you're not going to go anywhere without a grassroots. Mm-hmm. And that's why communities are so important.
Mm-hmm. Absolutely. That's a lovely note for me to invite Ellie to join us back on screen here. I'll turn it to you, Ellie.
Right. I just wanted to take this opportunity to thank you all, Bill, Matt, Georges. This was just a terrific conversation, as we knew it would be. I know I learned so much. I think we all did. I have a little bit of housekeeping to do. You all can stick around and hear my boring finish, but really, this has just been fabulous, and thank you. So, housekeeping, it's actually not boring. I wanted to remind you again about Public Health Thank You Day. We're really excited about it. The community, the public health community just deserves more recognition and thanks than we could ever possibly give them. Just some teasers, there will be some efforts in Congress around this day we're anticipating. And if you all would tweet, share on social media to get as much momentum behind this, to thank everyone in that community. And you all know out there how diverse they are, from researchers to public health nurses to the provider community, to everyone who is fighting every day for our health. And that is Public Health Thank You Day is Monday, November 22nd. I think there is a link in the chat for it. And let me see. And you can also visit our website for more information. And second, after a break for the Thanksgiving holiday, I hope you will join us for the next special discussion in this series. On Tuesday, November 30th, we'll be joined by another 2022 Outstanding Achievement in Public Health Award honoree. And thank you again, Johnson & Johnson, for these opportunities. We are honoring Dr. Vivian Penn, who the inaugural director of the Office of Research on Women's Health at NIH, and a women's health, a health equity leader nationally and internationally. We are just so excited. And Mary Woolley, our president and CEO, will be having a discussion with Dr. Penn. And so I'm just looking forward to seeing you all then and on Public Health Thank You Day. So take care.